Hi, I'm Dr. Kathy HoganBruen, a clinical psychologist in Washington, D.C., specializing in the treatment of anxiety disorders in young adults and adults. Today I want to talk specifically about social anxiety disorder and the population of emerging adults, so sort of late adolescents moving into college age and beyond. Social anxiety disorder is the fear of being judged or humiliated or embarrassed. It affects about 12% of our population at some point in time, and the average age of onset is around 13 years. It takes people about 10 years to seek treatment once symptoms begin, if they do seek treatment at all. So this is significant because that means it's about the time where other adolescents are more separating from their parents and kind of pushing into the world. People with social anxiety tend to be doing the opposite, which is pulling back and retreating. And this can cause a lot of problems for the eventual launch into adulthood because they're not meeting some milestones associated with adolescence, and skills are getting rusty. Even if the social skills are there, they're not getting used a lot. So the good news is that cognitive behavioral therapy can help. It's been found to be very effective by researchers who study this, and what it is two schools of therapy kind of join together. There's the cognitive, which addresses what's in our mind, what are we thinking about, and how does it affect how we feel emotionally, how does it affect what we do behaviorally, or what we're not doing if we're avoiding and pulling back. So cognitive behavioral therapy involves challenging negative automatic thoughts. These are the thoughts that just kind of run in our mind all day long. If you have social anxiety, there's a fair chance that they are pervasive and negative, irrational, exaggerated. So therapy aims to identify those and challenge them and help you replace them with more helpful thoughts that will be more encouraging of you achieving the goals that you want. And then behaviorally, we work at identifying specific goals, some concrete, tangible steps that you can take in order to get to the meaningful activities that you'd like to be happening in your life. We start treatment by identifying your values, what's important to you, so that the behaviors that we're working on aren't just because mom and dad said they are important. There are some tasks of adulthood that I like to fold into treatment, but I try to get that to be something that you care about too, that it's not just my agenda. So we start with your values, what's important to you, and how is social anxiety getting in the way. And then we can move into, like I said, challenging those negative thoughts that are interfering, but also behaviorally doing exposures. So we practice in the office what this will look like, and then we go out into the real world where necessary and possible. We just head right out of the office. So I work in DC where the sidewalk is bustling with people and stores and lots of opportunities to go chat with a barista at Starbucks or go return something to a store, which could be difficult, or order food, or make eye contact with strangers on the street, smile and say hello to the security guard. So we do a lot of that together. We first typically practice in the office, not always, but we can do role plays and identify if there are any social skills deficits that need some brushing up on. So this could be making eye contact, it could be smiling, it could be using body language and hand gestures, how to initiate a conversation, or how to interrupt somebody respectfully and politely, how to be assertive and get your needs met, how to talk to people who are in customer service, how to open a bank account, many of the adult tasks that people are avoiding because they cause a lot of anxiety. We also fold in mindfulness and practicing how to be okay with whatever's happening in the moment, even if that's anxiety. So as the anxiety bubbles up, letting it be there, making room for it, and learning that it's okay that you can be anxious and still do things, still interact socially, and reducing perfectionism, that it doesn't have to go perfectly, but there can be a pause in a conversation, or somebody can give a funny look, and that can be okay. So the main goal of treatment that I have for people is not to reduce the anxiety, although of course that's why you're coming in, and hopefully that does happen over time. But my main goal for the people I work with is for them to live a valued, meaningful life where they are active and engaged and doing things socially that they want to be doing rather than avoiding. If there's anxiety, that's okay. Hopefully the anxiety goes away, but if it doesn't, what I really want you to learn by doing exposures is that you can tolerate the anxiety and it can be okay. I also hope that when people are doing exposures, They are learning that the feared consequences that they imagine don't typically come true. And even if something negative does happen in one of these interactions, that's okay. You can roll with it, you can regroup, you can problem solve, and you can still come out of it with maybe having met somebody new or gotten your needs met. So that's really the goal I have for treatment, is to get you out there living your valued, meaningful life. And in the end, that doing these social exposures can lead you to where you want to be and can be ultimately fun and very rewarding. So I hope this has been helpful. Thank you very much.